welcome to the Rosengarten Practice Clinic. Today, in this video, we'll be talking about the options for penis enlargement. I'd like to show you the different methods we use to permanently increase the girth of the penile shaft and the glands, and explain how they work. I also want to explain the risks, as well as the pros and cons of each method, so that this video gives you a good overview of the available techniques. We'll start with the simplest type of penis enlargement, which is thickening with hyaluronic acid. You might know hyaluronic acid from its use in wrinkle injections for women and men in the face, but we also use this hyaluronic acid to achieve thickening in the penis, both in the shaft and the glands. The advantage of hyaluronic acid is that you don't need an elaborate surgery to get the hyaluronic acid injection. Instead, it's a quick, minor procedure that can usually be done under local anesthesia. Another advantage is that you don't need any additional liposuction. In a moment, we'll explain, or I'll explain to you, the difference compared to autologous fat transfer at this point, but you don't need surgery. Instead, the hyaluronic acid is artificially produced, meaning it's manufactured industrially, and then injected into the shaft and/or the tip of the penis. The downside of the hyaluronic acid injection, of course, is that hyaluronic acid is a biodegradable substance. That means, over the months, the amount of hyaluronic acid gradually decreases until, after about 9 months to a year, you end up right back where you started and may need another injection, which of course costs money again, requires another trip, and so on. So, for patients who, for example, want to try out how a penile thickening feels for them, the hyaluronic acid injection is a good option. And if you then come to the conclusion that penile thickening is the treatment you want, I would recommend switching to fat grafting, because that way you get a permanent result. The fat transfer procedure works like this. First, we discuss which areas we can harvest the fat from. Most of the time, the abdomen is available for this, or the thighs, or the flanks. The abdomen is a good choice because, well, the fat there is very stubborn, and that's exactly the kind of fat we want. We want to use stable fat tissue, and it's also very easy to extract it through the belly button. That means there are no scars left behind. This fat is then, as we say, harvested, that is, collected, gathered, and then processed. So those are basically the 3 steps before the injection: harvesting, collecting, processing, and then of course the re-injecting, which means putting the fat back into the shaft of the penis. All of this is done using relatively specialized techniques. For the patient, this is completely irrelevant, because as a patient, you'll of course be asleep under a short anesthesia. We also keep hearing that in other clinics, this procedure is performed under local anesthesia. We don't do that. We prefer to let you sleep. We want you to have a good memory of the operation. Just wake up, and the whole magic is already over, and you have the result you wanted. Nevertheless, this operation can of course be performed on an outpatient basis. That means you don't have to stay overnight at our clinic. Instead, after the operation and a short recovery period, you can be picked up by someone accompanying you and go home to sleep in your own bed.